Welcome to the office. Welcome to the office.
Thank you.
Okay, you got a few things going on here. And why don't we start with a few? We have back issue, we have deviated septum, and a few. Let's talk about the top three. What brings you here?
I think one of the main reasons is obviously I got a very stiff neck, and it started happening very recently. When I keep
Stiff
driving,
neck meaning on the left side here.
No, I meant here at the back.
The whole neck?
Yes, when I drive for 15-20 minutes and I always have this urge of cracking the neck, and it wasn't happening before that that much.
How long has it been going on?
I would say a couple of years.
Couple of years.
Yeah.
You're driving a lot?
Yeah.
Yeah, okay.
So that's one thing. Obviously, sitting for a long time due to work has caused some lower back pain.
Okay.
And one thing that my doctor noticed that you got deviated septum, and I have had allergy issues with congestion, converting to throat infection very easily. If there is any allergy wave coming in, I'm gonna get knocked out.
Okay, but you're told this is related to your deviated septum, the allergies.
I think so, just because it's kind of a smaller opening on one side, maybe.
Okay.
Maybe that it gets congested.
I have a different theory on
Is
it
it?
that we're
Okay.
going to talk about.
Okay.
The septum can affect breathing, absolutely. Septum can be related to breathing issues. Allergies is a different story, though.
Yeah.
And the way we were taught about allergies neurologically, according to the Gonstead work, anytime there's allergy skin conditions, we're always taught to look at the adrenal kidney system.
Oh, okay.
So if we're looking, what is an allergy? The body is fighting something.
Mm-hmm.
And if the body has to continuously fight, what is it? Is that a bad thing or a good thing?
It's a good thing. In a way.
It's kind of a good thing because it is defending. So, but the question is that why is it not able to keep it out completely? Maybe there's nerve pressure there. Could be. So when we're talking specifically allergies, are you allergic to something particular?
Pretty much all outdoor pollen, grass, ragweed, name it. Pretty much everything.
Okay.
So actually, COVID wearing mask was kind of helping me out.
Okay.
That went away, and I play out a lot.
Okay.
So that.
So this is going to be good for us to observe over the next few days, okay?
Absolutely.
And again, going back to allergy issues, historically we have found a sympathetic issue, part of the sympathetic nervous system related to the adrenal system.
Okay.
Okay, possibly. Do you get light sensitivities? Sunlight bother you at all? You get squinty eye? Do you have to wear sunglasses a lot?
Yes.
Yes?
Yes.
Do you, when you wake up in the morning, are you the guy who gets up and goes, or it takes you a little bit to get going?
Takes time.
Takes a little time. Half an hour to an hour?
Yeah.
Okay. So all these things I'm asking are related to the adrenal system. Hopefully we don't have to use snooze after this trip.
Perfect.
Let's
I'll
see.
be very happy.
Let's see. Okay. What else?
No, I mean, I play a lot, so I think I had a kind of torn ligament. Don't really have any issues, but yes, heel pain.
Both heels?
Yes. Sometimes it goes away, sometimes it really comes back.
Okay.
So I don't know what's...
Was there any trauma, slip, fall, anything you remember?
Since I was a young kid, I've been slipping, falling, playing sports so many times. I did gymnastics, I did soccer, cricket, name it. So I've fallen so many times, I lost track of it.
Okay, so we don't have to belabor all these little slips, not little, but all the slips and falls.
Yes.
What we need to look at and observe today is what's going on.
Yeah.
Where are you today?
Mm-hmm.
What are the x-rays telling us? And what is the condition of your foundation?
Yeah.
From there we can take it and look at everything else.
Okay.
Sound good?
Perfect.
All right, let's go over your x-rays. On the side profile, the first thing we're looking at is the posture. We're going to run a line, a posture line or a plumb line from the base of the L5, and we're going to run it up. It should bisect 7 and 2. It does bisect through your shoulder. So your shoulder and your hips line up. But here's the answer as to why your neck is always hurting. What you can see here is we have a slight anterior head carriage. You are forward from the midline. What the research shows is for every degree forward past neutral, and let's look at it, that's like an extra 10 pounds on the lower cervical spine. So in your case, we have 15 degrees of anterior head carriage times 10. That's like you have 100, you're carrying 150 pounds on your shoulders. That's why you're feeling that tightness all the time. So just in your normal posture, yes, you can make things pop and crack. So the idea here is in the posture, I will be giving you a few things to work on, okay, in order to keep the curve where it should be. Make sense?
Sure.
Cool. Now, let's go down to the foundation and let's see what are the things we see. So when we look at your foundation, we're looking first at the sacrum. We can see a couple of nubs there, a couple of tailbone injuries. That's fine. The good news here is your disc is good. This is your L5. It is a little bit tilted. The quality of the disc is good. 4 is good. You can see 3 is tilting. Okay? 3 is tilting. 2 is tilting. 2 is an old compression. We can see here there's an old compression injury, and you can see the pointing of the bone right there. It's trying to stabilize there. So what happened? 5, 4, 3. From 3 goes back, 2 goes with it, and it takes kind of the whole spine back. So the idea, we can see here that 3 is what's causing the whole spine to go posterior. Now, what's going to be interesting in your case along the way is as we start to change the foundation here, it's going to feel a little weird. It's like we have to retrain the posture of the upper body at that point. Why is that? You've successfully adapted in this position, but we have to rechange the position. Okay? All right. But the discs are good. This one is pinching a little bit here. Discs are still good, but you can see we're not seeing clearly through those disc lines, right? And that's because of the slight little kink in the middle of the back there. When we get to the mid back here, discs are good.
Is it because of that curvature my head is trying to lean forward? Or is it just the bad posture of movement?
There's two things. There's the body is compensating to the foundation.
Okay.
Now, like I said, you successfully have aligned your shoulders with your hips, but in that process it's doing this. So as we bring this back, this is going to want to come back, and that's coming from the third lumbar. So when we're looking at your foundation, what are some of the things that we see here? We don't have a lot of rotation in the pelvis. It's just a 1 millimeter down, 1 millimeter up on the left side. But we do have a leg length discrepancy. It's 5 millimeters. Regardless, it's under 7. Adjustments will hold. Okay? Now, what I'm seeing here is this. We don't have rotation of your sacrum. That's the good news. But we have a drop of the sacrum on the right side, 3 millimeters. And that drop has contributed to the short leg. So this is all coming from the tailbone. Okay, now it makes sense. But now we got to go a little deeper. Do you see this little kink here? Right there. Okay? So this kink, the coccyx, is bent a tiny bit here, then S5, S4, S3, S2. They're all angled down this way. And so what we're going to need to do, we're going to need to start on your tailbone, sir. You see these lines I'm drawing? So these are going parallel to the sacral grooves, okay? And so what I'm showing you here is that the tailbone actually formed a little bit off. So we're going to be starting somewhere down in here. We're going to try to get that sacrum up on that right side for you. You can see this here, right? This shadow here? Okay. This is your L5. This is your L4, L5, where they meet. Let me show you. So what I'm looking at here is this. This is the back here. We're looking at the articular pillar where the inferior articulating pillar of L4 is connecting to the superior articulating pillar of L5. And there was a trauma here, all part of it, where This is a callus. There's scar tissue. It's trying to just stabilize that area. Okay. Now, let's go to the side and see. Yeah, you see here? There's a big round mass almost. It looks like the capsule has calcified. But we do have to rule this out, okay? I need to make sure there's nothing else going on here. I may send it to double check. You see how this you can see through here? You can see through this line here, this joint. You can see through it here. It's a lot thicker here for some reason. I don't have that answer just yet, okay? Megan Blasi. Guys, this is a really nice Megan Blasi. The gastric air bubble is there. You have one of the better ones that we see here. This should be this size.
Oh, is it?
Most of the people I see, including your wife, is very small, very, very thin.
Okay.
Yours is actually very good. I'm happy with that.
What does it?
Means your digestion, at least you have the right gastric air bubble. You eat well.
Okay.
You've been eating well. So we can see from the tailbone down here, it goes to the right, right? Kings to the right. It's leaning, leaning, leaning. Then what's the body doing? It wants to compensate, and it wants to do what? Come back to neutral. This is the area where your body compensates, and when you sit a lot, it starts here, and then you're feeling it up here. Okay? Here we have a side slip. T1, 2, 3, 4, 5. So T5, we have a good side slip. There was a good blunt trauma that happened in this upper back here. You played cricket?
Yeah.
You a bowler?
Yeah.
Huh. You look like a bowler.
I'm a fast bowler, so
Yeah.
it puts a lot of
You
strain
didn't tell
on.
me this, did you?
No.
Did you tell me this?
No.
Yeah. So we have T5, we have the tailbone. Now let's get to the top here. The good news up here, we have some TMJ misalignment. Your upper cervical looks fantastic. Those capsules look great. When we're looking at misalignment, what's a little misleading is this. When we look at the jaw here, the jaw on the right looks thicker. The thicker jaw, or the thicker ramus of the mandible, indicates more of the compensation side. However, in your case, it looks like it does deviate down to from right to left. So it almost looks like his subluxation and compensation are on the same side for his TMJ, and that can happen. So his goes down and then goes out more to come down. Okay? You got smacked with the ball at some point?
Oh yeah, several times.
Back in the day. Okay. Does that make sense, sir?
Yeah.
Any questions on this?
So I think typical structure is, my lower jaw kind of comes out a little bit compared to typical baby straight. Is
Okay.
that one of the reasons TMJ, or that just natural? That's how I'm born.
That's a very good question. So TMJ goes a couple of ways. Number one is, so we're looking at upper cervical. So we're looking at the structure of the neck here first. That's number one. Number two is, did the trauma start that process? Number one. Or was it that we're eating differently, we're chewing foods differently?
Okay.
I have a feeling in your case most of this started from the physical stuff. Okay, that's my suspicion. That's extension, that's flexion. Flexion, they should all move forward, right? That one didn't move, that one didn't move, that one didn't move, that one, none of these are moving. It's all stiff. Okay? Now the question is, if I have to choose from any of these to start, if I find it at C7, I would work there, because you can see the tilt starts down here. Does that make sense? Okay. But let's examine you, let's watch you walk, and let's figure out where we're going to start. So what we can see there's a bit of swelling in his tailbone here. We can see as it goes up, this side is a little bit more pronounced and higher. This side goes out a little bit more, the wing bone I'm talking about. We're looking at the musculature here. So this hip is down on the right side, but what he's doing is he's hiking up. So he's engaging these muscles. You get tight in here, and when you, in the morning when you wake up and stretch, it pops here. Do you get
Not
any
much.
popping in the spine?
No popping.
No popping in the spine?
No.
All right, let's have him walk. Go ahead and walk towards the corner, please, of the room. And just keep walking, regular walk. And what we want to see is nice fluid motion of the SI joints, number one. Keep walking. Look straight ahead, please, as you're walking. So he has movement in the dimple, but I don't see a nice solid movement. I see it's a little bit unstable, if that makes sense. And then he shifts, he's got that left side wants to shift, so he does this. He got the left Sugarland wheel. Have a seat, please, and let's get started. Starting at the base of the neck. And let's see, isn't it easier? I've changed things a bit, guys. And we've gone to the traditional three-piece Gonstead set. So we're back to the cervical stool in this room. And I kind of miss it, it's nice. First thing we're getting, starting at the base, is going to be 10 points, C7, left side. C1, 15 points, left side. So this is the first part of the exam. Actually, the second part. First part of the exam that I do is the gait analysis and visual, watching the patient walk and looking at the overall presentation of the spine. Then we get into instrumentation. And when we're looking at instrumentation, what are some of the things we're looking for? We're basically looking for that heat deflection with the instrument. And we can see it all starts down low in the tailbone. All of this is, he has a lot of these compensations here. Now, there is something hiding out right there. So I got something around 2, 3, tailbone, 6, and 1. So this is a new prototype that I've been beta testing for a doctor. It's a digital scope.
Oh, nice.
Pretty cool.
Yeah.
So it's all digital, no mechanical parts. Thanks to Dr. Chris Meyer in Wisconsin. And Chris was generous enough to offer me to test this for him as well. And there are other field doctors out there. Now we're going to run the meter to make sure it compares. Okay? Let's see. Dun, 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 dun. Now few differences in this particular model. You can adjust the thermocouples individually here. You doing good, Shasha? How you doing? All right. So let's start at the base. And can you see that blue light there? You better see that blue light there. There it is. So I haven't figured out all the increments just yet, but it does match. 10 points on the left. Looks like it's going right, but then it comes left. Same thing. Match, match. Now, let's go. Can I show you guys something? So this is the old way, okay? So we have the cervical stool, and typically the doctor would bend down on the knee here. This is actually a lot more comfortable on the back too, guys. Just want to let them know that. Okay. Now, let's see what the rest of it looks like. So this area does have heat. Let's see if we have a break. Maybe a potential break there. All right. Now I got it over here. This one is a lot more sensitive, but it's picking them all up. Yes, sir. So I got the same confirmations on the 4. This one did show up something extra here. Okay? And interesting. So we're getting sacrum around L1, L2, around T11, C7, and C1. All right. Hey guys, what do you think? Old school. So one of the doctors describes this as one doctor described this as the Rolls Royce of scoping, right? They're nice, they're classic, they're really cool, they're heavy. Feel.
Yeah, all the mechanical.
There's your Tesla.
Very good.
Sorry, Elon. Sorry, Elon. Static palpation. Static palpation, we're looking for swelling, edema, point tenderness. So as we're running the fingers down the spine, you can see the swelling there. Starts to pool right there. More edema. When it gets here, it's gone. So I'm getting it more here. Let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9 more tender, 10 more tender. 9 or 8?
I think 9.
9.
Yeah, 9.
What did we talk about earlier about the adrenal system? Remember?
Mm-hmm.
That's your T9. T9, 10, but it can also come. How's 11? Not too bad?
I think, yeah, this one is slightly more, not this one.
11 more
Yes,
tender
yes.
or 9 more tender?
I think 9 is more.
9. We're going to go with 9. Okay, let's check the motion of the hips. Feet together, open and close the knees, open and close. Open and close. Feet are touching, open and close. Right side only. You can see when he does the right, the whole left wants to shift. Left side only. When he does the left, the right side is fine. So he has actually fixation on this left SI joint. Let's check the top of the joint, middle of the joint, bottom of the joint. More fixation at the bottom, yes?
Yeah, there's slight tender here.
Tender?
Yeah.
Okay. Now let's check over here. L5, S1, tender, S2, S3, S4. Not too bad, right?
Mm-hmm.
Back here.
Yeah, this one.
S2 or S3?
I think that's 2.
S2.
Yes.
S2, left SI joint. Head down, sir. S2, left SI. We're going to determine if we're going to do sacrum or pelvis. We're going to do the leg check for him. Let's go up. Now, if we have two potential cervicals, we have an upper cervical, we have a lower cervical. We're going to do a test to determine. Sit back for me, please. And before we do that, let's do static and motion palpation. Head down, please. Static palpation. Checking the posterior musculature. Good. Motion. 7, 1. 7, down. 6, 5, 4, 3, 2, 1. We're going to do divorce test. Divorce test is going to tell us where to start. Turn left, turn right. Turn left, turn right. Looking up is isolating the lower cervical. Turn left, turn right. Turn left. Now we're going to look down and isolate the upper cervical. Down and left, down and right. There's better movement when you look down, correct?
Mm-hmm.
Yeah. So we're going to do the base. Okay? So when we're looking down, that's the upper cervical. He has better movement that way. But when we look up, we're isolating the lower cervical. He has a little less movement that way. Correct?
Yeah, I think on this side.
On the right side is where you're getting stuck. Okay. So we have C7. We have T9. Now, let's determine, are we going to do the sacrum or the pelvis today, okay? So, we're trying to figure out this left SI joint, and let's do the leg check. Now, for the leg check, here's what we're looking at. We're looking at the heels. And what we can see, so you want to be directly on top there, the left is slightly higher, okay? But it's short, he had a right short, no, there you go. It shows the right is actually slightly higher because that's the short side, okay? Now, when I bend so the left side is longer, flat. When I bend the knees, if the left side stays longer, we're doing the pelvis. If the left side goes shorter, we're doing the sacrum to start. Yep, so the right side is slightly longer. Do you see that? There you go. Right side is slightly shorter. Bend the knee. Knees together, sir. Okay. Right side. Left stays short. Left goes short. We're going to do his sacrum. Okay. Sacrum, S2 on the right, T9, and C7. Ready? Let's do it. Then after that, we'll look at the shoulders and the ankles. We're not going to mess with the knee on the first visit when we're doing the foundation. We will do the septum today if you like. Good. And I just want to find that sweet spot. We're doing C7 as a PLS. C7, we want to be on the posterior lateral inferior aspect of the spinous process. So we're hooking it just like that, okay? I'm using the distal palmar surface of the index finger, getting right underneath. Bring that chin back to stack the vertebrae. And now he can feel it. I'm right underneath there, okay? Just like that. And it's going to lighten up. Let's lighten it up. Let's bring this back towards me. There it is. Good. Nice and easy there. Let's bring that left ear. Let's see how far down it goes. Good. Nice and easy there. Good. Now I'm leaning a little too much, so I want to bring myself up, bend the knee slightly so I don't hurt myself. Good. You're going to let that left shoulder drop? Like butter. Nice. Walk it off once, please. Straight line. And let's do the sacrum. You good there? Good, sir?
Yeah.
Cool.
I think where the crack I felt is roughly same area where the stiffness usually happens. I was constantly like jerking when I'm driving just to make sure it's...
But again, that's all from your foundation.
Yes.
I just want us to be clear about that. Let's go left side down, please. Okay, so I changed the table up so you guys can see this a little bit better, okay? And you tell me if you guys actually like this positioning better. Bottom leg straight, top leg is bent, and we decided to do the sacrum, okay? And we decided to do it left side up to help that SI joint more. And let's straighten everything out. Good. There you go. So, L5, 5, S1. You okay there?
Mm-hmm.
S2. So we're going to be on S2. We're going to torque slightly counterclockwise. Let it roll forward. Let it roll. Good. There it is. Let it roll. And that's the home run, baby. Hi! Come on up and let's walk it up. Good times. Alright. And as he's walking, let's see if anything is different there. Cool. Anything different there for you, sir?
Feeling a little light.
A little lighter?
Yeah.
Let's go left side down and see if I can get a tiny bit more. This is a better visual hopefully for you guys here. So same thing, I'm on the sacrum. Right there. We're gonna torque it down. Let it roll. Get high up on there. Good. You okay there, sir?
Mm-hmm.
Good. Lift. Lift. Oh, you're quick, dude. Lift. That's it. Come on up. Walk it off, please. A little more light. Now let's do T9, please. 5, 4, 3, 2, 1, 11, 10. Oh, yeah. That's the one. T9 we're setting as a PLS. Now what I'd like you to do, sir, drop the hands. Drop. Good. Home run, baby. Good stuff, brother. Let's walk it out. Nice deep breath in. There you go. Now let's have a seat back over here, please. And let's recheck. Now here's another thing about scoping, guys. I know not all Gonstead doctors post-scope. My mentor did, one of my main mentors did, and I do. And what I'm looking for in the post-scope, guys, I'm looking for either reduction 50% or more, 0, or even to the opposite side. Now, let's start at the base and let's see. 7 is clear. That cleared his neck. That was a good call we made. Good. Pretty cool, dude. T9 is clear. That cleared up your upper lumbar as well. Sacrum is clear. Let's use the other scope just to confirm. Do. Let's confirm. Let's turn the brightness up. I got a flutter of 1 point now. Different, 0. So far, so good, brother. Little flutters. Let's see how T9. Clear. Upper lumbar, clear. It's pretty cool, dude. Couple of flutters, but not like before, right, Shasha? It's pretty good, dude. All clear. I'll take it. Very nice. We have analog and digital confirmation. May I continue, sir? Yeah. Yep. Okay. Let's take a look. Shoulders. Sit up straight. Circumduction. Right shoulder's good. Left shoulder's good. Let's work on that jaw. Sit back for me and let's test the jaw now, okay? Open, close. Let's watch slowly as it opens. Slowly open. Slowly close. Slowly open. The left actually comes out and then the right goes. So this is our right side first. Okay, right there. You feel that? Mm-hmm. For a TMJ, we're doing the EX. So one of the certification questions is, when is the only time you adjust a compensation before the actual subluxation in the Gonstead work? And the answer is TMJ. Chin down. Good. Open all the way, sir. Close halfway. Hold it there. We're applying a lateral to medial pressure. Right to left side. There you go. Shukr. I know. It's still there. Slowly open. Open. Little different, brother. Good. Now let's do the machine for the jaw. You okay?
Yeah. Okay.
Cool. And we'll do his deviated septum today as well. 5, 4, 3, 2, 1. All right. Sir, let's go on the gray table. Let's check out that septum for you. So I want to clear up a lot of these misconceptions about the septum. Okay, especially for all you guys out there. The septum, it is cartilage. It is cartilaginous, absolutely. You have the nasal bone. From the nasal bone, there's the septum cartilage, and then this whole thing is cartilage. There's the connection of the cartilage to the bone. That's what we're adjusting. Okay? And it does have an audible sometimes. Sometimes it doesn't. Go on your back, please. I remember the first septum adjustment I saw Dr. Working do at a Gonstead seminar. This guy was a boxer, one of the students, and that thing was so crooked and it popped so loud, and he actually straightened it. It was pretty cool. Chin down, please. Let's take a look here, Shashi. So what we're looking at, okay, so we can see that there is deviation of the nose, first thing. Now we want to determine chin down. Okay. This is the bone right here. This is the bone, nasal bone. By the way, guys, that's the skull. That's the nasal bone. This right here is the cartilage. That's the septum. Now, when I push on left to right, it moves fine. Is there any pain with that?
No.
Now, when I push right to left, that don't feel so good. Correct? Right there. So it looks what? It's going this way. But when we look at the actual septum, it's stuck on the right. I'm going to let you decide. You're here for a few days from Texas. If you really want to know, I'll do it right now. If you want to wait a day and see if allergies or any of this stuff changes from that T9, okay? Does it matter?
I think sometimes not allergies, but
Stuffiness?
breathing.
So it's different from the allergy.
Yeah.
TK. Okay. We're pushing right to left, chin down. Now there are some people who do it like this. That is correct also. Chin down. There you go. Gotcha. A little bit better. Can I get a tiny bit more though? Can I get a little more? One more?
Okay.
Bus. Deep breath in and out. There you go. Walk off that nose job. Let's walk it off. Take. Now do me a favor, as you're walking a couple of times, tell me what's different with anything.
I think I'm feeling a little lighter just because here I felt stiffness in the
Okay.
center. I think
Okay.
after that,
So I want you to document from today any changes, okay? Anything different. Most important is the breathing allergies, back stuff, and the neck stiffness and tightness. Come over here, please. Let's check the hands. Squeeze. Now, on this side, you're feeling it more. This is the ulna. This is the humerus. You feel it more when I push on the humerus or the ulna?
I think here is this portion here, yeah.
Okay. So, squeeze. Squeeze. That's where we're going to start, okay? Questions for today?
No, nothing right now.
Your nose is nice and red.
Yeah. Got a nose job in here.
Welcome
Thank you so
to the
much.